Emergency Preparedness Director at Essentia, is joining us. Hildy is involved in the planning for an expected surge of COVID-19 patients, both from an Essentia-specific perspective and also from more of a community-wide response. Similar to past weeks, we'll start with remarks from Drs. Pryor and Van Dielen, and then we'll open it up to questions. Dr. Prabhu and Dr. Thompson, infectious disease specialists at Essentia and St. Luke's, respectively, also are back. As opposed to last week, we're back to the webinar format. So questions can be asked via the raise your hand function and then waiting to be called on, or by submitting them in the Q&A feature. You'll notice the Q&A button at the bottom of your screen, and we'll do our best to answer as many questions as possible. And if you do have a question, please say your name, the media outlet you're with, and to whom your question is directed. And it's felt like about 45 minutes has worked pretty well, so we'll try to wrap it up again today right around 12:15. And with that, I will turn it over to Dr. Pryor.
Great. Welcome back, everyone. I have to say that Hildy Perla and Dr. Thompson and Prabhu, they're the real experts, and I am just so pleased to be working with all of them and the entire group at St. Luke's. So thank you, everybody. I'm Dr. John Pryor, president of the Essentia Health's East Market. I want to start by acknowledging that this idea of staying at home has become rather polarizing. And I get it, especially now as spring blooms following one of our cruel winters, or at least one of our snowier winters, if you don't think it was cruel. None of us want to be stuck inside or tethered to our neighborhoods. We want to be getting the cabin or camper ready. We want to be logging miles ahead of grandma's marathon. We want to be at a ball game or a long lake walk. But many of these diversions are on hold. And that's a good thing as we try to contain COVID-19, which, by the way, Minnesota is doing about as well as any other state. Per capita, our infection rate is among the lowest in the country. That success should strengthen our resolve to continue abiding by Governor Walz's stay-at-home order. One of the reasons social distancing is so important is because we don't always know who's infected and who isn't. Studies indicate that up to 20% of patients who have tested positive for COVID-19 never develop significant symptoms. And actually, in some other countries, it may be much higher than 20%. Some of the most recent literature suggests. That makes it very dangerous and complicated, and it underscores precisely why we're staying at home. At Essentia, one of the biggest ways we're helping folks do that is through virtual visits. This has been a remarkable journey. The first day we offered virtual visits, less than a month ago, we conducted 2 of them. Now we're doing 3,000 per day, and we're up to about 40,000 overall. They are available across a variety of specialties: physical therapy, obstetrics, orthopedics, behavioral health, for example. For more information, go to essentiahealth.org and search virtual visit. That doesn't mean we won't see you in person. If you need treatment right away, please know that we're still here for you. We often encounter stories of patients with urgent symptoms who choose to stay home rather than come to the clinic or hospital. They're nervous about COVID-19, but ignoring severe symptoms can be even more dangerous than staying at home. When you come to see us, know that our top priority is to keep you safe and our staff safe. So if you need to be seen, let us help you. Of course, you can help us too. I feel like I'm making a plea for masks every week, but the need remains. We're now requiring patients and visitors to wear masks, and while we encourage them to bring their own, we'll provide one if needed. This is critically important. Because of the prevalence of persons who are infected but asymptomatic, it's crucial to keep as many mouths and nose covered as possible. But when we give you a mask, it will also further erode our supply. So those homemade cloth face masks are vital right now, and we continue to seek assistance from community members who already have blown us away with their giving. Your donation of masks, good old homemade ones or bought ones, can be dropped off at our Miller Hill Health Plaza in the former Yonkers building. Final word before I turn it over to Dr. Van Dielen. During these uncertain times, many people are facing their own mortality. Difficult as it may be, we really encourage you to consider advanced care planning and to complete advanced care directive. This will ensure that if you're unable to speak for yourself during a medical crisis, your loved ones and healthcare team fully understand your goals, your values, and your wishes. Then they can advocate for you. While COVID-19 can affect people of any age, it's especially dangerous for those with underlying medical conditions and those over the age of 65. So please get your preferences down in writing. To get started, go to essentiahealth.org, click on classes and events, then advanced care planning. Thank you, everyone. Be safe.
Dr. Van Deelen?
Thanks, Louis. Thanks, Dr. Pryor. And thanks for so much collaboration from all of our friends and colleagues at Essentia. I want to start just by echoing what Dr. Pryor said. Many will face difficult medical decisions at some point in their lives. For some, these decisions may come at a time when they're unable to speak for themselves. Creating an advanced care plan, otherwise known as a healthcare directive, a living will, or designating a durable power of attorney, eases the decision-making process for loved ones and ensures that an individual's wishes are respected. Especially in this time, when hospitals have significantly restricted visitors, your family may not be able to be with you if you're hospitalized. Having these conversations now, when you're not in a heartbreaking situation, when you're instead in the comfort of your own home, allows them to be thoughtful and meaningful for you and your loved ones. To learn more about advanced care planning, please visit the St. Luke's internet site, slhduluth.com/ACP for advanced care planning. That's slhduluth.com/ACP. I also want to remind everyone that it's important that you still call 911 if you have an urgent medical need or come to our emergency department. If you're pregnant and you haven't planned to deliver at home, don't try to. If you think you're showing signs of a heart attack or stroke, or you feel like you're having trouble breathing, these are serious life-threatening conditions. If you're worried about COVID-19, know that our emergency department staff is standing ready and prepared. They have the appropriate PPE, and they will treat you and keep you safe while doing it. Again, I can't stress how important it is to get the care you need where you need it. We're prepared for it. The safety and the health of our patients, staff, and community is of paramount importance to everybody at St. Luke's. It's important for us to reassure everyone that we are committed to doing whatever we can to protect your health. We're diligently following the infection control measures set forth by the Centers for Disease Control. These include practicing social distancing at registration and our waiting areas, limiting the number of visitors to our hospitals and clinics, canceling elective procedures, suspending volunteer activities, creating educational videos specifically about social distancing, good hygiene practices, disinfecting patient rooms, clipboards, and pens after every patient use, relentlessly practicing good hygiene and appropriate PPE usage. We're offering telehealth visits instead of in-person visits when those are possible, in addition to the free e-care visits if you have a concern about COVID-19. In addition, we have the free nursing triage line for patients who have concerns, and that can be reached at 218-249-4200. Similar to Essentia, we realize the importance of masking. This is a safety precaution we're taking to protect our patients and staff, and we're now requiring that all employees wear masks while working. Previously, we strongly recommended they wear them. Now they must wear them while interacting with others or when there is potential to interact with others. We do really appreciate the cloth masks as well, and we appreciate you bringing your own mask if you have one and are coming to one of our clinics or our hospital. We want to remind folks that our clinic building and the hospital are currently safe. We've taken measures to make them so, and we hope that you will seek in-person care if you need to. But we've also continued to move really a variety of visits into telehealth visits. For instance, now physical, occupational, and speech therapy can be accessed via telehealth. Again, not all patients' needs will be met in that fashion, but we want to make sure that you know that. I'd like to finish by taking this time just to thank the community. Your wonderful outpouring of support has been truly inspirational, and you'll never know just how much it means to us and all of our healthcare workers.
Thank you, Dr. Van Dielen, and thank you to Dr. Pryor as well. We'll start it off with a question here. This one is for both Essentia and St. Luke's. How are you doing on procuring enough PPE? And could you also address how you may be reusing or sanitizing that PPE?
Actually, Hildy Perla, that may be a good question for you to answer. Hildy, are you on the line?
I am. We have instituted some conservation measures, and one of them would be the disinfecting through UV light. And we have some teams set up that are looking at how we can safely do that. So they collect certain masks after use, disinfect, and we've got a process set up for that. Currently, we share our PPE numbers with the state twice a week, like other healthcare organizations, and continue to have conversations and share information on the best places to get PPE to keep our stockpile up.
Yeah, I would, from the St. Luke standpoint, really mirror what Hildy shared. We continue to actively seek out sources for PPE. We have adequate stores currently, but we know we have to preserve these critical supplies as we approach the surge of patients that we expect. We have taken great care to be very explicit with our staff about what is appropriate PPE, again, conserving very specific levels of PPE for specific areas of care, and that's really following the guidance from the CDC and MDH. PPE is challenging right now, given that there's been really a disruption to the supply lines, but we are in reasonably good shape now.
I'll go to Mr. Lundy.
Oops. Now can you hear me?
We can hear you, John.
Okay. Yeah, this is a question actually for Dr. Pryor. I understand that at Essentia you had to extend your layoffs for those who had been laid off previously this week, and that you had to add additional staff layoffs this week. Could you fill the numbers in for me on how, particularly the number of additional staff?
So no, I'm not going to talk about the numbers because I don't have the exact number, and I think that people are still trying to figure out the details. And so I would encourage you to contact our communication office to ask that question. I would say that what we are doing is no different than any health system in America right now. Overall, you should know that Minnesota Hospital Association has looked at the loss of revenue and the increased costs associated with trying to combat COVID-19. And in Minnesota, overall, the healthcare systems are losing $1 billion a month. That's a lot of money. And so what we're trying to do is basically flex our volume down. So for people, primarily clinicians and often nursing staff, we're trying to flex down to the volume. And for some staff, we're putting on a special administrative leave so that if they're not busy right now and we don't need them to take care of our patients currently, we put them in this special administrative leave category, and they do get benefits, and we anticipate calling them back when we hit the surge. But the whole goal here, and this is a very important message, is we're trying to preserve our resources so that when this surge happens, we can continue to function and pay people, so that we can take care of the many patients that we're anticipating when this eventually occurs.
If I could follow up just real briefly, do you know how much Essentia is losing, like, per day or per week or whatever the case might be?
We do have numbers, but it varies, and we're trying to mitigate that. I think the number overall for health systems in Minnesota, so I'm going to give you one overall for MHA, is right around that $30 million a day. But there's some big health systems and there's some small, $30 million a month, I apologize. There's some big health systems, there's some small health systems, so that's just kind of an average number. But if you look at the $1 billion a month, we're one of the larger systems in Minnesota, and you can approximately figure out what it is per month for us.
I forgot to unmute myself there. Another question, and this is for both organizations. Why do you think Minnesota has one of the lowest infection rates in the country so far?
Well, I think it'll be interesting to see what others think, but I think it's because of the fact that we tend to be rule followers in Minnesota. Our governor has asked us by executive order, has told us by executive order to stay at home, maintain social distancing. He's given us rationale on why to do that. And I think it was a great decision, and it's responsible for why we are where we are today. There's plenty of states where they have not done that. And even though there's a couple of them that have a less infection rate right now, that the numbers of infections that they have are exponentially growing faster than ours. And so I'm really proud of how we've responded in Minnesota. And I would ask my other colleagues if they've got any different.
Dr. Prabhu, I agree with Dr. Pryor. The social distancing has been key. Also, it has to do with population density. So in northern Minnesota, we're relatively rural compared to the metro area. Those two play certainly a role.
Next question is, it says for both organizations, are you still admitting people for inpatient psychiatry? What about ED visits for psych emergencies?
Yeah, I can take that one, Louis. Yes. So we remain fully functional as a hospital, providing all the same levels of care that we did prior to the beginnings of our preparation for this pandemic. And we do continue to see mental health emergencies in the emergency department, and we admit those individuals who would benefit from it.
Same at Essentia. We're open for business.
Has testing increased at the Duluth sites for both Essentia and St. Luke's?
So there's a lot of confusion out there about testing, and having just participated in our statewide call this morning, it's clear that that exists really at multiple levels. So we are still challenged in the state of Minnesota in regards to testing capacity. The good news is we are able to do some more testing. We can do testing now on site at St. Luke's. And we also use 2 reference labs that we send tests out to, but we are limited by the available test kits and by the swabs and media to make those test kits up. And we know that as testing increases, the capacity of the both our lab and the reference labs diminishes. So we wish we can test, but we wish we had a whole lot more capacity to test.
And this is Andrew Thompson. I would just add that based on the recent guideline changes from the Minnesota Department of Health, we are testing more groups of people. but again, we are limited by the supplies. We have the ability to, it's just a matter of having a lab that can run those tests and result them to us.
Dr. Prabhu, I guess for Essentia, we currently now do have inpatient testing capabilities, and we're prioritizing those for people that are going to be hospitalized, or it helps with disposition for a patient, meaning if we admit someone from a nursing home and they need to return to the nursing home, as an example, we can potentially retest them to make sure they're not infectious. And we still use our reference lab for testing, and it's more of a long-term issue in terms of the swabs that we use to test people. I think that's a concern for many healthcare organizations.
And Governor Walz has talked about reopening the Minnesota economy when hospitals can test 5,000 patients a day. And as you guys had just alluded to, both Essentia and St. Luke's are helping contribute to that number. But are there conversations ongoing kind of around that 5,000 number and what that would mean in terms of reopening the economy?
Yeah, this is Dr. Prabhu. I'll take a first stab at that. So, St. Luke's and Essentia are participating in a regular group meeting sponsored by the Governor and Minnesota Department of Health about testing criteria, who we should test, and also about surveillance. So those discussions are ongoing, even considering if certain health systems have the capacity to test more people, as long as they, first do the top 8 priorities, meaning people that are going to be hospitalized, healthcare workers, people over the age of 65, those with health conditions, people that work in congregate settings, such as what you call child care providers, et cetera. So if we deem by our own internal analysis that we can meet those priority groups, we can certainly expand beyond that, but it's, again, reassurances that we have adequate testing supply, swabs that we can do. At the moment, Mayo Clinic is saying they have the capacity for people in Minnesota at least 12,000 tests per day. But certainly the emphasis that he talked about, 5,000 tests per day, I would say that's capacity. We're currently at less than maybe, say, 1,500 per day, the whole state. But certainly we want to give people the opportunity to be tested if they're symptomatic, but it's more about the supply chain.
This is Andrew Thompson. I would also add that 5,000 number is sort of arbitrary, and it's a good goal to have additional testing capacity, but it implies a lot of other things. Just because we can test, we have to be able to take action on those results. And so we want to be able to diagnose people who have active disease and exclude them from public contact. And also, there's been a lot of discussion about serology, so testing people's blood to determine if they have already had the infection. And there are a lot of unknowns in that situation, such as if you've had it, are you truly immune from getting it again? And how reliable is that blood test? So it's a worthy goal to increase our amount of testing, but I think it also requires further action and further understanding.
Next up, question says, when are we expecting the surge to be in the Northland? And has this time frame changed?
I can start with that, Andrew Thompson.
Please, go ahead.
Here. There are multiple different models out there about when the surge may happen. And it basically it depends on what inputs we put into the models about when it could happen. I think the ones that take the most data into account are most regional data would indicate that a surge would happen into June or July. And in part, that's because we have done good social distancing up front, which helps delay the surge and potentially even reduce the peak of it.
Yeah, I would say that pretty much agree with that. I guess the question is, the surge is when you really start to feel it, and that could be potentially in May or June. When it peaks sometime likely in the summer. The farther out you get, the more inaccurate some of these models are. And I would have to say that we change even on a weekly basis as we learn more about what's going on in Minnesota and we learn from other states. We feed that data into the models, and the models change slightly. So both when the peak occurs and how severe it will be is unknown and changes frequently. But we are keeping our eye on that as we get closer. We'll be able to predict better exactly when it'll happen.
John Lundy?
A question for Dr. Prabhu and Dr. Thompson. We've seen, unfortunately, a cluster of cases at St. Anne's, and nothing like that we're aware of, at least in any other facility in the immediate region. Do you have any input on what might have gone wrong at St. Anne's?
Andrew Thompson, I can start. In essence, I don't know what went wrong there. I think, though, it reflects the incredible risk that some congregate settings have. Certainly, there was a visitor at some point that brought the virus into that facility, and then in a congregate living facility like that, it's so easy for this virus to spread, especially if we're not immediately aware that it's present. So that is the reason we continue to do these significant restrictions. We really want to protect the most vulnerable. And I think that, we have seen this play out all across the country. When it gets into a nursing facility like that, what can happen?
Yeah, Dr. Prabhu, and that's, I guess, an example why it's so important for universal masking, both for visitors and employees all the time, and the point Dr. Pryor had made about a significant percentage of people be asymptomatic or minimally symptomatic, and that masking really helps protect, spreading the virus to others.
Let me just build on that a little bit. And maybe Hildy can also talk about what we're doing so this doesn't happen at other congregate settings. But as soon as we found out that there was a patient from St. Anne's that was COVID positive, people did spring into action. And Dr. Prabhu is being very, he's trying to be very humble in the fact that he went there himself right away as soon as we realized that these cases were happening, to assess the situation and finding out what we needed to do to control the infections and prevent things from expanding. I know that St. Luke's and Essentia got together staff to help fill some of the shifts at St. Anne's. St. Louis County made a request for Minnesota response volunteers to help out. And both St. Louis County and Minnesota Department of Health and the Northeast Healthcare Coalition came together to offer help, including some possible sources of funding like grants. So a lot of people really mobilized forces very quickly to help in this very unfortunate situation. And I don't know, Hildy, if you've got some thoughts on either St. Anne's or what as a region we're doing to prevent another situation like this from happening in congregate settings.
Thank you, Dr. Pryor. I do think this is a good example that really highlights this invisible infrastructure in the background of our planning and response, in that as healthcare systems and with our coalition and with St. Louis County Public Health, we've been working together collaboratively for years. So when a situation like this occurred, we knew who to call and we knew how to pool our resources to come together and respond. This situation is an opportunity also to look ahead and say, how can we stop this from happening in another place? So we continue to meet as a work group and look at what does that response team possibly look like so that we can assist locally for any other organizations that would be in this situation. St. Louis County is getting proactive and looking at the way they can deploy their resources to go out and check with facilities before there is the problem. And the Minnesota Department of Health has added a long-term care resource center to their state EOC. So at all levels, we are sharing information, we're learning from one another. And to your point, Dr. Pryor, we want to be very proactive and assist our community to not have it replicated.
Go to Brooks.
Hey, thanks. If Essentia won't talk numbers of increased furloughs or layoffs, can St. Luke's detail the number of employees now on leave or laid off? And can both of you talk about when those employees are expected to be called back?
Yeah, I don't have specific numbers for you, Brooks. St. Luke's, like Essentia, has been experiencing a dramatic decrease in our patient volumes. And so we have to adjust our staffing in order to be really careful stewards so that we're able to provide the resources when we need them. I think, the challenge in this is we know that in the very near future, it's truly going to be an all hands on deck. So we're trying to be very, very careful about how this is done. We're working with all employee groups across St. Luke's to try and do this in a way that is most respectful. While I don't have numbers, I can tell you that we are struggling with the same situation.
Let me just say, that while we don't want to share the numbers, we are doing this again with an eye to the future and with the understanding that we view all 14,000 employees as part of the Essentia family. And these are very difficult decisions, and we try to do them with care and compassion, both for the people that are put on these administrative leaves or are flexed down and the people that remain. So the reason why we're not sharing specific numbers is, besides not having the exact number at my fingertips, we want to do this primarily out of the compassion for our employees. We don't want them to worry. We don't want them to, just over concerned for their feelings and what might be happening in the future. It's best that we just don't talk about it publicly.
Another question from Dan about PPE and all of these companies that are making PPE, Cirrus, Frost River, Duluth Pack, etc., along with individuals. And Dan wonders, how do you do quality control on that equipment, and just how helpful are these efforts? Are they just kind of feel-good efforts to a certain degree, or are they really making an impact?
I can address that, Louis. They're specific to some of the projects that we've been party to, and I'll use the Frost River Cirrus partnership. These are really gifted organizations that are able to design and produce things at a very high level and also test them. And we know there's been some sharing of specifications, and so we know what we have to reach for adequate protection. So I would say that the work's that is being done is not just feel good. These are actually products that are protective, and we do intend to use.
And this is Andrew Thompson. I would also add that a very simple piece of equipment that's been made by local companies, Frost River, are these face shields, which offer better protection than we normally would have in this situation. It's not like we stocked thousands and thousands of face shields from a medical vendor, but in this situation, they're particularly effective at both preserving our masks and giving employees protection. So it is not simply a feel-good gesture. These are actually quite effective.
Yeah, Dr. Prabhu, also with the universal masking for our visitors and patients, we are kind of ahead of the curve because our community businesses have been stepped up in making masks for us as well. So we've been very grateful for that. And the issue with there's something called like a PAPR hood, meaning someone that cannot be fitted for an N95, meaning they fail the test based on their facial sort of features. That's when we need the PAPRs, and we did participate in the specifications to make sure that those are safe for our employees, staff to use.
Question for both organizations. What would both Essentia and St. Luke say to those who are urging lawmakers to let us all go back to work in normal daily life sooner rather than later?
So I think we all want to get back to normal life, but I can't reinforce what Dr. Pryor said. The reason why the state of Minnesota is doing as well as we are is really a function of the governor's stay-at-home order and how well we're all doing at staying at home. So I would say that as we get more testing capacity, as we can identify the individuals who really need to be kept away from other folks, I think we may be able to do targeted openings of the economy, and I think that would be really important and impactful. But we are not ready to open up everything. We will, I'm afraid, experience a significant increase in disease if we do that.
I would say that the decision needs to be made based on data and science, and I think that is exactly what Governor Wallace is trying to do. Obviously, everybody wants the economy to improve and people get back to some sort of normalcy. We all crave for that, as we started off this press conference talking about, but doing it too soon will lead to a worsening of the peak with more people affected, more people dying, but potentially a second or even a third wave as well. So I think we need to do it with great care, and certainly having more testing and contact tracing and sequestering and quarantining people who are positive that we identify from these tests will certainly help us get there. And also I know that people are thinking about how to do it in a very smart way, not just saying, oh, we're all back to normal, but being very strategic on what businesses to open up. And I think that that's a really a good way to approach this. I think we're all going to need to be patient though, and realize that this is going to take a lot of grit to get through and to save lives.
I don't see any other hands up or questions in the Q&A area. And so unless anybody objects, I think we can wrap it up a little sooner than expected here this afternoon. I want to thank everybody for joining us, and thank you for the doctors and Hildy for making some time. These things have become pretty effective at allowing us to connect with our reporters and community. So thank you, everybody, and we will plan on meeting here again next week at the same time.